I am Viviana Martinez Bianchi. I am a family physician. I am the team leader for the health equity team for Family Medicine for America's Health. I am also the residency program director at the Duke Family Medicine Residency Program. And I sit in the board of directors of the World Organization of Family Doctors in the executive as a member at large and represent family medicine, the World Organization of Family Doctors to the World Health Organization. Health Equity Team for Family Medicine for America's Health. The Health Equity Team for Family Medicine for America's Health has been charged with making sure that health equity, eliminating health disparities, is at the forefront of the activities of all the other teams. In my thoughts is that in family medicine in particular, but in medicine in particular, health equity, eliminating health disparities, has to be at the heart of what we do as physicians. It has to be at the heart of what we do in healthcare teams, hospital teams, and that it has to really expand beyond the walls of our clinical work. The work of the health equity team is important for FMA Health, for Family Medicine for America's Health, because it really is keeping an eye that, for example, if you introduce new technology, are you introducing it only with those practices who are wealthy enough to accept them? What happens if only wealthy practices can acquire new technology? Could this end up dividing or causing further disparities? When you're working with the community, if you're not thinking about principles of community engagement and collaborative practices, we also can create further health inequities. When we're talking about innovation and practice improvement, also, what do we do for those practices who may have less opportunities to build on new programs? So always keeping the idea that when we work in any of the areas of the teams, another example, research. We need to aim research at recognizing disparities among those who have better outcomes and more difficult outcomes with healthcare, and finding what is it that is driving those disparities. So the health equity team is really at paying attention that all of the other teams are having the conversation of health disparities and health equities as a forefront, that they don't provoke further disparities through the type of work that they're doing. So if I think about the changes in the healthcare landscape, this is a moment in America where we have to be really, really mindful about the consequences of current politics and current policy changes that can actually take a whole portion of Americans, the most vulnerable populations, into really, really worsening health. If we think about budget cuts that are coming our way, that in regards to Medicaid, in regards to access to care for women in reproductive rights, if we think about children and access to health care, if we think about and this is in particular in healthcare, we're seeing cuts that are really, really going to be a problem for our communities. But if we think about other cuts, when it comes to cutting education funding, when it comes to really not providing the best education, the best housing, the best transportation for people in our communities, we're going to definitely see worsening health disparities if we're not really paying attention to those. So the current climate environment in my community, in our communities, in our country, it's really, what it does to our team is to give us, as a result, a bigger strength and bigger determination to really work. So a real vivid example of our current political environment and how it can affect the life of kids in our communities. Recently had a 7-year-old who comes in, suddenly developing for the last 2 months, urinating himself in class. Has never had this problem before, doesn't happen at home, doesn't happen at night. So I'm working with a resident. He takes care of the child. We walk back in the room, and I notice that they have a Hispanic last name. I know the mom. I took care of her for her prenatal care, 7 years ago when this baby was in her womb. We're talking and trying to understand what's going on. The child tells us that there is a bully, but he's a little bit nervous, or he's not really telling what's going on. And then finally I turn to the mom and I say, tell me, do you have papers? And she gets tears in her eyes and says, well, I don't, but the children are American citizens. The children were born in the US. The fear that she has right now, that she will be deported, caused for her to, in September, to tell the children that if they were to come home in the bus and not see her at home, she's not there, that this is where their papers are, this is where their birth certificates are, this is where it shows that they are American citizens, and these are the people that they need to connect with, and that if she is deported, that they're going to be okay, and that she's going to call the school if this happens, or she's going to try to leave them a message if she gets booked by immigration services. Now, this is a woman who has worked in the United States for over 20 years. This mom told this child this story in September, and this is when this child started having trouble going to the bathroom. And the issue is he doesn't want to leave the classroom because he thinks the mom is going to call the teacher, and if he leaves the classroom, he's going to miss the phone call. So the child is having problems with urination because he's afraid that his mom is going to be deported and he's not going to be able to hear the phone call. This is just a tiny little story to illustrate how any changes in policy affect the people in a way that can be very significant in worsening their health.